Self-rooming. We looked at our patients from the time that we implemented this, and I'll just say May 1st, it was actually April 28th, to the end of August. So we had about 6,000 or more patients in there. We looked at one visit type, a well baby check. Well baby check, mom's coming in with a child and they're waiting to get in and those kind of things. 76% of these patients roomed themselves. They went directly from registration to their room. Now we also track the amount of time it takes a nurse to get in there, and we're running right about 2 minutes. Which is actually, we estimated to begin with, we were going to have it 5 minutes. So we're actually outperforming our original goal. But what we actually found is that on the darker blue bars on the left and the white bars, the darker blue bars are the self-rooming patients. And so what you're seeing here is they're spending more time with the nurse. Less time if you go to a traditional waiting area. They're spending slightly more time with the doctor. They're spending less time in the room alone. Their overall cycle time or their overall treatment time is less. Now, if you're a mom with a fussy baby, quick in, quick out, more time with the nurse, more time with the doc, seems to me that adds value. So those are the kind of things we're trying to do. When you're talking about less time for total visit time, you're talking about increased capacity, or at least the opportunity to increase your capacity without having to build additional square footage. Now, you might think that this is only a couple of minutes, but if it's a couple of minutes per patient, and there's 480 minutes in a day, and a doctor sees 20 patients a day. That's 80 minutes at the end of the day, 4 return visits, times 210 work days a year. That's capacity. We've talked about room utilization, and room utilization is an interesting thing. Most times we count room utilization as the amount of time a patient's in a room. To me, a patient in a room without a provider is a patient in another waiting room. Because true utilization is when there's a patient and a caregiver in the room, when the room is being used for its purpose.